That's totally fine.
All right. Okay, we'll let people in.
Perfect. All right. So we have a couple people here already. Hi, everyone. Thank you so much for joining tonight. I'm sure everyone's been having a very busy week, so we really appreciate your participation. So today this is our second to last API Heritage Month event webinar series, and today we are collaborating with the Multicultural Veterinary Medical Association for this collaborative panel with 3 panelists that have kindly offered their time to share their experience navigating practice in the clinical setting during the height of the pandemic as Asian veterinary professionals. We have Dr. Shun Kimura, who is a equine resident, and then we have Michael Hung, who is a Texas A&M resident on diagnostic imaging. Did I get that right?
That's actually Candace.
Oh, no, I'm sorry. No, I did not get that right.
Yes.
No, that was Dr. Tam. Dr. Michael Hung is IM resident.
Yes, yes.
Yes, okay, perfect. And then Dr. Candace Tam, who is also a Texas A&M resident for diagnostic imaging. So I botched that. That was my bad. But we have 3 fantastic panelists here to share their experience. And then at any point in time for all of our participants here, if you guys have any questions to any of our panelists, just feel free to put the questions in the chat box. Dr. Quixel will be looking at all of that and will be able to answer any questions that you guys have either in between, otherwise at the end of this webinar today. So before I get started, does anybody have any questions, any burning statement they want to make?
I just wanted to let people know that we are planning on recording this and we'll have it available on YouTube later. So if you know anybody who couldn't make it tonight but wants to watch it, it'll be available then.
Thank you, Dr. Quixel. That's an important one to mention. All right, so why don't we have our 3 panelists first just go through a brief introduction, just a better one than I can. I guess we can start with Dr. Kimura, and then we can move on to Dr. Hung, and then to Dr. Tam.
Hi, everybody. Thank you to AAVMP and MCVMA for allowing me to be here today. My name is Shun Kimura. I'm actually Japanese, but I grew up in a lot of different places. I did my vet school at Tuskegee University, graduated 2017, did my internship at UGA in field services in 2018. And then I just completed my residency back in 2021 at Auburn in equine internal medicine. So I'm currently doing my PhD at the University of Georgia in comparative biomedical sciences.
I am Michael Hung. Again, thank you for this opportunity to be able to share my experience. As Dr. Kimura has expressed, I was born in LA, in Los Angeles, California, to Chinese immigrants. I completed my training at UC Davis, and then I was an intern at Texas A&M when the pandemic started. And then transition into an internal medicine residency for the rest of the pandemic.
Hi, everyone. I'm Candace. I am originally from an outside neighborhood of Houston, Texas. It's called Tomball, Texas, very small. I grew up in Texas, and then I went to vet school in California, actually at Western University of Health Sciences. And then I did my rotating internship at Texas A&M last year, and then they kept me on as a diagnostic imaging resident. So I was an intern during the pandemic and now an imaging resident towards the tail end, hopefully, of the pandemic now.
Perfect. Thank you guys for your introductions. So I'm going to start with the first question, and really that's the bulk of today's panel. Hello, Kitty. So with over the last 2.5 years going, how have you guys navigated the challenges of the pandemic, along the whole anti-Asian hate crimes that's been going on and the discrimination over the last several years? If maybe what we can do is have Dr. Kimura answer it, and then Dr. Hong answer, and then at the end, Dr. Tam answer, just kind of in that same chronological order.
Yeah, that sounds good. So, well, okay. So basically, when the pandemic started, I was actually in right in the middle of I was just about to finish my second year of residency. And that was really kind of, it was a, it was kind of crazy, right? I think we all sort of have our stories about how that happened and how that was. But I think that one of the things that was really challenging for me, I think, was that I had just become a father at that around this time. So in August, so 6 to 7 months before it sort of things started to really drastically change for the with the pandemic, was when we welcomed our daughter. And so when the pandemic hit, I think there were these, there was the stressors of residency, there was the stresses of just the personal sort of concerns, especially as somebody who's got asthma. And so I think I was very worried about this acute respiratory virus that people were really having quite severe clinical signs with. And it really doesn't help being an internist, because then you really know the pathophysiology of all that. And then thinking about not only family in terms of my wife, but we've got this 6 to 7 month old that it doesn't really haven't really had a chance to build up an immune system, and probably would have quite a severe manifestation. And so I think there was that aspect of it that I think really was hard to sort of navigate and juggle. The other part of it with with this pandemic was the anti-Asian discrimination. And what really happened was, I think as some of the things had transitioned, essentially a lot of things kind of built between the stressors of that were involved in the residency, having a family, and this phenomena just seems like a terrible, it just doesn't quite cut it, right? It's just this, these things. And I ended up having to find a way to actually take a step away from clinics because it got so bad. And that was pretty challenging. And essentially, I had to take a step back and sort of negotiate. And essentially took a few months, and I was able to actually take that opportunity to get mental health care that you really don't really get a chance to really look for or get during your residency, right? You're just supposed to stuff it all in. And so I actually was able to take that step back, get help. And also part of the things I was able to negotiate was being able to keep our daughter at home while I got to be a stay-at-home dad for that, to sort of, and that was sort of a big thing. The other part to sort of navigate was, I didn't really say this in my introduction, but I used to live in Zambia. So a big part of my life, my childhood was living in Zambia. And it was interesting to sort of see some of the things from growing up there. And Zambia is a fairly safe country, but you get trained by the embassies to be careful with who's following you and things like that. And so that was sort of ingrained in me and sort of whittled away as I moved back to the States to do college and onward. But it was interesting to sort of see that side of vigilance sort of come back in a different way with all of this anxiety provoking stressors coming in. And so I think a lot of it was that really taking care about where I was going, and really not, if there was any incidents of a that seemed to be behind me a little bit too closely, I would end up having to sort of do different detours and things like that. And I don't think it really helped that being an equine internal medicine resident, and with my job also having an ambulatory duty at night at rural parts of Alabama, didn't really help. So I think that, what's interesting about it is that all of this anxiety and things that I experience, and my resident mates are all women. And so it's not like they didn't necessarily have these anxieties either. But I definitely felt like this was something that I was having a hard time shaking compared to them. So yeah, I think I've talked long enough, but hopefully that was a start to sort of starting this conversation.
Yeah, I think for me, I think when the pandemic came on, thank you for sharing, Dr. Kimura. When me and the pandemic came on, I was an intern that primarily we were switched onto emergency, right? Because most of the departments, the hospital decided to close, as most of the clinics did, as most hospitals did during that uncertain time where you're not really sure how to kind of handle these things. And so a lot of stressors came from a perception that is kind of prevalent, unfortunately prevalent through the industry, is that like we weren't, that we were kind of used at the expense of our own mental health and our own fears of wanting to care for the patients for which we swore an oath to do. But at the same time, like all these questions, like how do you social distance in the ER or in the hospital clinic? What kind of masks do you wear? What do you enforce? And so I don't know if it's like fortunately or unfortunately for me, I suppose I did not experience a lot of direct antagonism as a result of my race. Partly also, they can't really see what I look like. And I also have the privilege of not speaking with an accent. And I believe that colleagues that spoke with an accent were really heavily disadvantaged over the phone, because sometimes you already have stressed out clients that are coming to you. And if they can't really understand what you're saying, they can say some very hurtful things over the phone. And it's hard because you want to, on one side, you don't want to take that. On the other side, you also understand that you're working in the ER environment, that everybody is stressed out. And unfortunately, and I don't know if this is unfortunately, if this is fortunately, but there was a sense of just you roll with it, which I don't know if that was a healthy thing to do overall, because now we know that just rolling with it is not a positive or healthy thing to do long term. There were instances in hospital at Texas A&M, unfortunately, of people that probably used rhetoric that wasn't good, like calling it the Chinese virus. And so that was definitely something that I was aware of. I do think that the hospital did take care to address that instance directly, and they made efforts to make sure that where they could, they were developing organizations, task forces to make sure that we did feel more secure. But I do think in that initial couple of weeks, as someone that was working, people that were going out, it was very stressful in terms of mental health. You felt like you weren't being cared for, and at the same time, you didn't really feel like you had another option of which to turn to. I think that I think the main thing of the difference from I had from my non-Asian peers was just that I knew that I was different, and I knew that this was something. You knew what people had called that. People knew oh, this is from China. I have friends that come from different ends of the political spectrum that believed different things, and sometimes you did just want to keep quiet just so that you could you didn't disrupt anything, that you can continue go about your life. That was essentially you wake up, you go to ER, you experience the reality of the ER, and then you just go home and you go to sleep and you work another day. As the pandemic kind of normalized, then the frustration started to turn to, why are we treating things differently than other hospitals? And I think like my colleague, Dr. Candace Tam can probably speak to that, because she is in a different position than I am as I moved to residency, which I think specialty practice probably had a different experience. I think like the ER experience, I think is also a specific and unique one, especially as the days went on.
Thank you guys for y'all's answers. I guess it's my turn now. So like I said in my introduction, I'm actually from Texas, and I grew up in a suburb of Texas where in my mom's backyard, like the neighborhood park had cows like behind. So it wasn't big at the time in terms of city-wise, population-wise. So growing up, I grew up as one of 3 maybe Asian kids in my entire middle school, elementary school up until high school. Then I maybe had 20. But so I grew up around mainly Caucasian people. So growing up, looking back, I faced a lot of microaggressions and a lot of racism that I just chalked up as, oh, they just call me Great Wall of China because I'm tall, right? So, oh, that's just a joke. That's just what it is. And that's what I grew up around. It wasn't until I became much older, and I moved away to college, became like incorporated in the Asian community. And then when I moved away to California, and Southern California has a big Asian community, that was probably the first time where I realized, okay, this is where I belong. And this is normal. It's not normal to make fun of people, calling them young, it's not funny to do that. It's not okay. And so when the pandemic happened, I think I had been in California for 4 years. I was actually in Boston on an externship when the first case of COVID was diagnosed in Boston. I think it was Boston, yeah, something like that. Chicago or Boston, one of those. And I was actually just walking to the north end from the train station that I got off of, and someone yelled "chink" at me. And I was just like, oh my God, like I've not been called that word in so long. And I didn't even know how to react. I remember I just stopped and I was like, what? And then something went off in my brain, and I went off on this person. And I was like, you want to call me that? You picked the wrong girl. And I just went off, and they were scared. They're like, oh my God. And then they backed off. And I was like, yeah. And unfortunately, that's not the only time that happened in this past like 2.5 years. I think I told Michael, there was one time I was jogging on one of the streets here, and someone in a big truck, yelled it out the window at me, and then like sped off. And I was like, do you feel better about yourself? I don't understand why that was necessary, but okay. So it's weird coming from a place that was like this growing up, and then moving away, experiencing what normal is, and then coming back to this. I almost feel like it's not that I'm not affected, it's just that I have dealt with it my whole life. Now I'm like, okay, here we go again. And so there are incidences in, as an intern, like Michael said, last year, we really didn't have a lot of face-to-face contact. Everything was over the phone. So a lot of people didn't know I was, my parents are from Taiwan. They don't know I'm from immigrants and I'm of Asian descent, until they start asking things like, oh, Tam, where is that from? Things like that. And then they start asking, or they'll ask your students about you. And there was an incident where a client asked their student, where is Dr. Yi, who's another resident at our hospital, where is she from? And is she Chinese? And the student, who is also Chinese, by the way, her name is Alicia, she's also Chinese. He's like, oh, is she Chinese? And the student's like, I don't actually know, I have no idea. He's like, oh yeah, like, doesn't matter how long they're here for, they never lose their accents. I can hear her accent. And Dr. Yi grew up in Georgia. She does not have an accent, but it's things like that, and then they called us Oriental and things like that. And it's just those kind of things where you're like, God, you're so uneducated and it's so harmful, but they just don't know. And it's like, is it because of COVID that this has happened? Or is it just because we're in Texas that this is happening? It's hard to say. And then in terms of how it's different from my non-Asian peers, I will say that I don't think that they think that my non-Asian peers ever thought last year when someone was abrasive towards them, is it because I'm Asian? They never have that thought. They never have that inkling in the back of their mind. I think I'm the only intern, or maybe even the only doctor so far in the past couple of years that has been threatened to be like a client threatened to shoot, come back and shoot us up because we wouldn't let them into the hospital, which is a hospital policy, and things like that. So it's kind of like, is it because this guy is just unwell, or is it because of my ethnicity? Is it because I'm Asian? I don't know. And I think it's hard because if you let yourself sit there and think about it and dwell in it, you will go to a dark spot. But I think because I grew up here, this is what I'm used to, I tend to not let it bother me, and I will become aggressive back. And when that person threatened to shoot us, I damn well called the police, and they said, do you want to file a restraining order? I said, yes. And I had them stay at the door until we got the dog taken care of and had them off on their way. So, you know, things like that. And I know I had an intern mate who's also, she's Japanese, and I think she had a harder time adjusting to things than I did, and which is unfortunate. But yeah, now that I'm in diagnostic imaging, I don't have that much experience with clients anymore. I think now the struggle is I am definitely a small animal oriented person. That's been my experience. And I think in our hospital, small animal is pretty very welcoming, very open. We have a great like supportive community of everyone. So doesn't matter what color, what orientation, whatever, like everyone is very welcoming of everyone for the most part. I think the difficult part for me now is going to large animal, which is a totally different world. No offense, Dr. Kimura, but it is a different world. And it makes me, I sometimes wonder, oh, are they treating me different again because I'm Asian, or is it just because I'm a first-year resident and they know I don't know what I'm talking about? So no, those struggles or those thoughts have now just transferred to a different part. So, but I think for the most part, it is all in my brain. It's not actually them thinking anything about me. I think it's just my own insecurities. But yeah, that's been my experience.
Thank you so much for sharing. And I also just love Dr. Tam's energy of like, you say something to me, I will give it right back to you. I absolutely love that energy. So I do have a follow-up question for just from what you guys have talked about. So you guys have kind of mentioned, you know, the differences of your experience compared to your non-Asian peers. What about with, I think, you know, Dr. Tam mentioned this a little bit as well, but what about with other Asian veterinary professionals within the campus, or I guess the hospital setting you guys work at, or if there is even one or a couple others? Have you guys had any change in your relationship with them? Any sort of like solidarity, for example, or is it sort of like business as usual, trying not to let anything bother you? What's been your overall experience with that the last few years?
So I think I think it's pretty much a given that this, you know, in light of how homogenous and lacking in diversity veterinary medicine is in general, I think it's pretty obvious and evident to say that when you now shifted towards large animal medicine, or like just a large animal field, it becomes even more homogenous. And so I think you know, one of the things about Auburn was that the anesthesiologist, the large animal anesthesiologist, is her name is Hui Chu Lin, and she is one of the loveliest clinicians around. And I think that she was welcoming to start, and I don't think it had anything to do with me being being Asian, but I very much felt like mommed by her, and so I think it was really comforting to know that she was sort of around. That being said, I think, and then over on the ECC side, there's you know, there was Dr. Kendon Ko. I don't know if any of you know him. He's a criticalist, and he's quite the jokester, and he's a very lovely faculty member. And I think I got to know him a little bit more. You know, we sort of had this like banter that was going on. I think he would always make it a point whenever I was doing student rounds with the equines, you know, with the senior students, that he would sort of crash it and just sort of sit down and, you know, mess around. And that's what he kind of clowned around and doing. But, you know, I think when the pandemic hit and this rise in anti-Asian sentiments started to really come front and center, I think he and I think, began to talk a lot more. And I think it was sort of comforting to get to know him more in that, and feel sort of this, I think to have somebody there that I could talk to about that. And I think, one of the things that I think was, and I think with Dr. Lin, I think, it's interesting that I didn't go to her. And I think part of it was that, and it wasn't because of anything that, she did, because she's this lovely person. I could always go to her. But I think something about it was just a little bit of shame, having felt this sort of, these feelings, right, that I couldn't sort of shake off. And I think for some reason I couldn't, something sort of prevented that for me for the longest time. So I think, there was, and I think when, essentially when, like, with the folks that were around, I think I don't think there was anything ever that was sort of overtly or, overtly or explicitly said, but I think, we all sort of had this underlying sort of, we have to take care of each other sort of feeling that was sort of around, I think. But like, there really weren't too many, Asian clinicians around me aside from that. So I think, and a lot of it was, I think, as Michael had said, there was this sort of like, just get through it type of feelings too, right? I think there was just a state of survival, really. And I think just trying to keep an eye and, sort of watch out for each other, either quietly or explicitly, I think is sort of how I sort of experienced that.
Yeah, I think that can you ask the question again? I feel like I'm distracted because I read the questions in the chat, but I just want to clarify what I'm actually answering.
Yeah, no, it's I just want to hear your experience on, working with or being with other Asian veterinary professionals, whether there's been any increase in like solidarity or kinship, or if it's like business as usual, just to keep the ball rolling, as you said before.
Thank you. Sorry for asking you to repeat yourself. There were, when I first started, I think there was only one other Asian doctor at Texas A&M. And so, I mean, I do find it more easy to talk to them in general. I think maybe there is some shared experiences just in terms of things that we are familiar with. I think that but initially, I think because I was the only, I really hope I'm correct, but I think I was the only Asian intern in my class. And so it was kind of, for me, I was in a way used to that, because veterinary medicine, as she mentioned, is not filled with Asian people in general. And so even at Davis, I kind of recognized that. But I think as more like Asian Americans kind of came to the hospital the following year, like when I was a resident, I do think that like we actually did kind of hang out together. We would be able to share meals, like be able to like say like, oh, I haven't had like, for example, like Korean barbecue in a really long time. Like we can try and make it. I actually think that I hosted more hot pot get-togethers than I ever had anywhere, because so many people had not heard of it, and I was, very willing to have people come and participate. And if there was someone that was Asian, I was like, hey, I'm gonna have some hot pot. Do you want to come? So yeah, I think there was definitely camaraderie between all of us. I think there is definitely some cultural similarities and things that we are used to in the way that we speak to each other, the way that we joke, or just because there is a subliminal comfort in being with people that look like us. And so I don't think I like consciously did that, but I do think it is easier for me to do so. And so even though I would still probably say like the ones I'm closest to now would be, resident mates, intern mates that aren't necessarily the same ethnicity that I am. I do think that like if I see Candace, or there's like Christine Chang is another veterinarian at our hospital. It's just easy to talk with them, to chat, to catch up for a little bit. I would say maybe a little bit more easier so than others, because I don't know what life was like, or like without a pandemic looming over it. I don't know if that is if that would have happened regardless, but I do think that it is there now.
Yeah, and just to piggyback on Michael, I completely agree. I think once I came here, I definitely gravitated towards the Asian clinicians that we had. While there were few, we were strong. And I've noticed things, Michael, like you mentioned the hot pot, like we have our foodie group, which is just like, but I just noticed it's like a bunch of Asian people and like their spouses. And then we just come together and do hot pot Korean barbecue, things like that. We still need to do like our Vietnamese spring roll night, but we'll get there eventually. But it's things like that. And I don't think it's because we're trying to be exclusive. I think it's because there's comfort in knowing, like Michael said, like there's something very comforting about knowing that I can talk to Michael and just like, hey, you want to get boba? And he's like, yeah, or I'm too busy. But he won't ever say, what is that? I don't know if I like this boba. It's not this weird, I have to explain things. And he's not going to be weird about what is hot pot? You mean it's raw? Like things like that. Like, you don't have to explain yourself, and there's comfort in that. And whether or not COVID did that or we would have done that naturally, I don't know. And it's really funny because I literally had this conversation with some of my college friends who we all grew up in similar areas where the Asian population wasn't big. We didn't really have Asian friends growing up. And once we went to college, we all gravitated to each other. It's kind of like, it was a very subconscious thing. We didn't mean to do that. It just happened. So, COVID wasn't a thing back then, but I think it speaks volumes to, wow, there is something comforting about having friends who have shared experiences with you. So, yeah.
Yeah, thank you so much for sharing all of that. And really, I relate so much to the food being comfort aspect. And that's very true. I host, not to digress, but I host like 4 or 5 hot pot events per year with my fiance who's from Hong Kong. So yeah, absolutely. Food is comfort for us. So we do have a couple questions here already in the chat box. I'm just going to go over the first one by Ashley. So she has a question for all of you guys. How has this pandemic and the increase in AAPI discrimination and violence changed your views and activism for rights for other marginalized communities, such as the Black Lives Matter, the LGBTQ plus community, etc.?
So I think that's a really great question. And I think I think that even before this, I would say that there was a lot of feelings of experiencing the pain, but I think it's something else when that pain becomes even more real, when it becomes more visceral, when when you see these things happening now on the news, it translates so differently. What I remember, sort of to answer your question, I think a little bit more is when back in 2016, 2017, when the Trump presidency began, I think that was a time when a lot of my classmates had really experienced like being in Tuskegee, and I think being amongst a community of of people that were essentially very apprehensive about this transition, and many of them having this realization of people that they thought were friends weren't being they couldn't consider to be allies. And I think when that happened, I remember the shift and my friends explaining to me that that was a time when they had to really readjust their paradigm and really went through a dark place. And it was one thing to sort of hear them talk about it and feel that pain, but when I think with the things that happened here, particularly, I think heightening it up even more, that visceral pain became even more real. And I think that what that makes me realize is that having to, I think to be more aggressively, so to speak, supportive, to be either more explicitly, present, being more compassionate and understanding, and taking more time, especially in this profession and in where we are, where it is so homogenous. I think it's made me sort of take a step back a little bit more and take a few moments and be more intentional in having the conversations that need to be said. When you realize that there's, especially I think when I was in clinics a lot more, when they would look more, when folks would look more uncomfortable. And I think, especially in those situations, asking and saying, hey, is there something that I can do? Is, like, what's going on, not singling them out, but, taking that time away, to, have that courage to talk about it and have more conversations about that. I think it gave me a little bit more courage to do that. And it gave me a little bit, be a bit bolder. So I think that it was, I think that for prior to this, maybe I was more passive, and I think it definitely gave me a little bit more of a motivation or spark to be a little bit more, I feel like aggressive is not the right word. Explicit, I guess, is what I'm trying to say here. Yeah.
For me, it gave me there was a reminder that I agree that it kind of became more real to myself, but also the understanding that I still have it pretty good, and that there are people that have suffered and gone through more than I have. I think during the I think the height of the George Floyd protests, that was when there was I think there was a lot of social media explosion. I think just given that we were in Texas, in my community, that there were a lot of people on different sides of the spectrum. And it was hurtful, because sometimes you would be like, oh, I didn't know they thought that way. And then you would also see people that would speak up that were usually quiet because they felt inclined to share their own experiences. And that was my first time, because I have a coworker who identified who is Black. And so that was my first time going to this kind of a protest, and to be able to support her in that, and letting her know that we supported her. And I think that it just made me a lot more aware, because of however much that I feel, I'm still cisgender Asian male. And so there are things in life that I am used to and I don't fear. And I know that there are people that are not that don't have that luxury. And if I feel a certain way about something, I know that in marginalized communities like LGBTQ, IA community, I guess you can say like Chinese is a minority, but I think when I say minority, I do mean the Black community, indigenous communities, and I would say like even and also like immigrants. I do think that they had a different perception of what it's like to be here, and the reminder that whatever I felt, they probably felt it worse. And I think that it was a good reminder to be aware of that and to be cautious of that, and also to support them as well.
I think this is a great question. And the cat's going crazy. Go away. No, okay, he's gonna do his thing. Okay, question. I'm here. So I think in terms of being supportive, or how I personally felt about the marginalized communities, was it was always supportive. I definitely went to marches. I was very vocal about things. Always felt bad, right? Like, this isn't right. These things shouldn't happen. Everyone deserves basic human rights. These have always been my opinions. However, I think one thing that's very interesting we don't talk about often is that while Asians are minorities, we tend to be considered like up minorities, which is a term I had never really heard before until I spoke to one of my friends who is Black, and he told me, it's not the same. And I said, why? Why is it not the same? We're both people of color. Why is it not the same? And they're like, because we are down minorities, you're an up minority. You guys, people don't make fun of you or don't arrest you for being Asian. People make fun of you for being good at math. People arrest and kill us because of my skin color, even if I'm doing the same thing you're doing. And I was like, oh shit, like, I had never thought of it like that before, right? And I thought back on my own experiences. Yeah, I've never been put in dangerous situations up until COVID, right? Where I'd never been put in dangerous situations. I never had to have a talk with my mom about, when you're going out and you see a cop, put your hands up, don't do anything, don't say anything, immediately just do what they say, right? I've never had that conversation. My brothers have never had that conversation. So I think once the hate crime started with the Asian community after COVID, it made me empathize. It made me finally realize, oh, now people are actually getting physical with us because of the skin color, and not just physical with me, or like not necessarily me, but with our elders in our community. That's just messed up. And so while I'll never understand what it feels like to be in those more marginalized communities that have been marginalized for so long, I think it gives me just a little bit more empathy before all I had was sympathy, because I didn't understand because I've never been put in those situations. But now it's crossed from sympathy to empathy, and being able to understand on a different level, and also opening the door to have those conversations, and then having just space at the table so we can all talk about these things. It's not comfortable, it's not easy, but it's made me want to have these conversations more. And I'm not afraid to have those conversations with people, learning things about each other. It's important. And that's kind of how I feel now. I've always been pro affirmative action. Now I'm even more so. So it's things like that. So I feel like everything I felt before was just amped up a little bit more, and just understanding on a deeper level.
That you guys all made really fantastic points. And then just because you were the last to talk, Dr. Tam, the sympathy from empathy is such a great point that you've made. I think, I think that everything that you guys have been through, that we've all been through as a community, I do think that there's some level of solidarity that has increased amongst other marginalized communities, and you guys have definitely, established that for sure. We do have another question from Kimberly. So first of all, she says, thank you to all the panelists for being so open and vulnerable. I would 100% agree with that. Thank you guys. So the question is, was there discrimination experienced from coworkers, not only clients as well during this time? How has your employer tried to make the work environment feel safer and more inclusive?
I guess
I can speak.
okay, yeah. If
I
you don't mind,
didn't,
if
you
you
can
want to
go
start,
first.
that'd
I
be
didn't
great.
want you to feel like.
Oh, no. I think I was
first.
gonna ask if we're just gonna keep it the order. So please, Michael, actually, I'd prefer if you don't mind starting.
It's up to you guys.
Yeah,
Yeah,
go for
I can
it.
certainly. I think this is the question where I forgot what the question was originally because I was thinking about it. I touched on it. I didn't hear much about it, which was good, but there was someone that was referring to COVID as like the Chinese virus and didn't want to wear a mask and such. And I didn't hear much about it, which was because they were immediately talked to. And so I think that was the main thing that comes to mind when thinking about discrimination from coworkers. this in terms of, you know, being discriminatory based on what they had called the virus. I also, otherwise, I don't think that I experienced much from my coworkers. Our employer did take efforts to make things better. I think that there were challenges in terms of when the first wave of COVID or the second wave of COVID, I think that most of the hospital was unmasked. And so that was kind of, that was uncomfortable because there was this order that, you know, governmental institutions couldn't enforce mask wearing in the state of Texas. And yeah, we were kind of here being kind of uncomfortable about it and feeling like we couldn't speak up. Fortunately, as things were escalated, they did take efforts to wear a mask and make us feel a little bit more comfortable about where we were at. I also remember with the question that there was, and there was an instance of Asian American violence. Well, not just one instance, but it might have been when an elderly lady was attacked in San Francisco. But I do remember one of the faculty taking me aside and asking me if I was okay, just out of recognizing my race and where I come from. And of course, me being isolated and just not really being aware of what was going on. I didn't know what she was referring to initially, but she didn't say it outright. And then she was, no, I just want to make sure that you didn't feel like I want to make sure that you feel safe, that you're comfortable, and tell me what I can do to make things better if you're not. And so I actually appreciate that a lot, that she took me aside and let me know that she was here for me if I did feel otherwise. And so I remember that. And so I think overall, I think there can always be improvements, as there can be anywhere, as people are trying to adjust to what was going on. That I do appreciate that discrimination was unfortunately not non-existent, but was quickly addressed. And that I do remember that there are people that reached out, people that were not, and this faculty was not Asian, and so she was white. And so people that reached out to make sure that I was okay.
Yeah, and I can definitely piggyback again off Michael, because we are at the same institution. But I think there is an incident that I remember hearing about where a coworker had made a joke about the Kung flu. Oh, I got the Kung flu, or something like that. Or I was scared I got the Kung flu. And they just made this comment as a joke, like, and you wouldn't have expected this person to say it. And it was just so like, what? And when I heard about it, the people who told me about it, they were Hispanic and a Caucasian girl, and they immediately shut this person down. They went and reported it immediately to our admin, and it was addressed like within the day, not even like an hour or two later, right? So it was addressed very quickly. And I think while there are microaggressions from people and your coworkers, like they say things, do things, and you know the way they think because of how they talk and how they post on Facebook, I think the workplace has created such a good environment of letting people know if you have any discrimination, it'll be addressed immediately. And I think that that's an excellent thing. And when it comes to, Michael mentioned like the mask situation, I never really want to speak up about it, because I don't know how you feel about this, Michael, but like, I never want to be the one who's like, wear a mask, because I don't want people to be like, well, you're the reason, you know? So it's almost like I don't want to put myself in a situation where it'll target people to come after me. And so I would never really say anything, even though I should have like the courage to, but I just never really did. And up until I think they held this like forum for just residents to speak, and they really speak their mind, and without anyone else around, it's just us and the dean of this college. And the thing that I was most not surprised because I know that our resident mates and our cohort is very supportive. But the one thing that I found very comforting was the people who spoke the most were not Asian. Like a lot of people had the same concerns as we all did, and they were very vocal, and like we didn't have to put ourselves in that awkward situation because we had people around us who are comfortable and who blend in easier, and they were willing to speak up. And I don't think it was because they were like, I'm looking out for Michael and Candace. It wasn't that, but it was just this environment where, you know, you don't always have to take on that burden because other people are willing to carry that and help distribute the weight, which I think is really amazing. So I think we've been lucky here, at least with that.
Yeah, so I think that I was trying to think on the question because I don't think I experienced any discrimination from coworkers like per se. I think that or I don't think that there were any changes in attitudes between pre-COVID and post-COVID. I think in terms of doing the clinical work, I think a lot of it felt like it was business as usual. I think it felt like I've always developed a really great rapport with the nursing staff, who I adored. I think that really, so, and the support staff too. And I think that, I didn't experience any sort of difficulty in that realm when COVID hit. I think in some ways we probably didn't have time for that because it was, the way that our hospital operated when it was, without students was basically, for the internal medicine, it was the senior and then a resident sort of managing all of the cases. And this was during foaling season, so we were quite busy. And it was quite intense as we, for some reason, had record dummy foals and septic foals and all of that. It was just foals for days. And with the nursing staff too, right? So I think everybody was just sort of trying to make sure that everything was staying afloat. So I don't think that there was that. I would say though that I didn't really hear much from my employer in terms of when these things were happening. I think there was maybe one, if that, like sort of we condemn these violence against Asian Americans during this time. And that was kind of it. And I think there was one from the college. I think there was one from the governor. I think there was one from the different, veterinary organizations respectively. But I don't think that there was really, I think aside from that, like nobody really, felt like they were reaching out or anything like that. And, part of it might be that, we were just all trying to stay afloat. But I think a lot of, it did felt very quiet on my end. So in terms of answering, was there anything that made you feel safer and more inclusive? I wouldn't say so. And I think what would have felt safer for me, I think was, and I think for, initially when, in the middle of the pandemic, it felt the safest because they actually didn't have us do the on-calls at the field. So we were at the hospital and I was very relieved. But when they were trying to transition back, and still in the young stages of this pandemic with the Asian violence that was still going on, I think that was when I definitely shut down because I did not feel safe enough to do that. So I think, so I guess that it was, I think it kind of is a contrast to what y'all had experienced, so.
Yeah, thank you everybody for the questions and the thoughtful responses. As Kimberly, I think is the one that asked the question, is saying in the chat as well. So kind of the next question come from our kind of question bank here. So what are some things you do or have done to help take care of your mental health and well-being, particularly in the last couple of years during the pandemic when it's been so challenging?
I've had to recognize that I'm more than my profession. And I had to sacrifice and like realize that I want to do my best, but if my best is going to change who I am, then I don't think that I would be willing to sacrifice that. I think there's also, I think, a need to grieve if I needed to share any kind of negative emotions. My grandma actually passed away during the pandemic, not not due to COVID, due to a stroke. And it was, yeah, I think in the midst of everything, you sometimes are hardened to it and you don't really feel the grief that is there until you kind of take a second and have someone ask you, are you okay? And being able to process that. I really wasn't. I cried at work when someone asked when I was recounting, and just realized between everything that was going on, because you were just kind of trying to get through each day. Sometimes you didn't have the time to process something that happened. And I think being able to take time and process it, being able to step back from your workplace, is something that is needed. I think it's easier said than done. I think it's easy to be like, yeah, I'm gonna take this day off, but some people may not be able to take a day off. But I think what helped was people that were in a similar life stage, people that were completely different from my profession, and so that I could talk about something else. And I also remembering that I'm not, I think that my profession is a big part of what I am, but I also have other things that define me as well. And remembering that, especially as typically we all work more than 40 hours, as is clinically, I feel like most people work more than 40 hours in the workplace. I think taking that limited amount of time to be able to focus on something else, even if it means, I'm going to be careful about saying this, but even if it means sacrificing something that's sacrificing a little bit of work, I think has been immensely helpful for me to be able to step away from it and also be able to talk about it.
Yeah, I agree, Michael. I think a big part, one thing I notice, it's a big difference between me and some of my coworkers is when they go home, they get back on their computers and they start doing more work from home, and it's like, oh, but we have work, those hours for work set aside so we can do work at work. And I don't know if that's, and I know sometimes you can't help it. Sometimes when you're slammed at work, you have to go home and keep working. That's completely understandable. But there are times when you can just say, you know what, I've done the best I can and I'm good with it. And I think that's a really hard concept for people to understand. It was hard for me as well, but I think I hit a point during my internship where I was just like, you know what, I'm practicing good medicine. I'm a good doctor. I do the best I can for my patients. And if I'm doing all of those things, I don't have to worry about anything else. Because if you're honest and you're being true, and it sounds like I'm talking about a Disney movie now, but it's true. Like if you're practicing good medicine, if you're honest with yourself, honest with your clients, and you're doing the best for your patient, advocating for your patient, that's all you can do. And you can't, I just can't take it home with me anymore. Right. And so those are things that I try to remember and remind myself. It's hard. And like Michael knows, I've definitely cried to him about stuff or talked about patients. I'm like, oh my God, this is terrible. But I think the important thing is to sit. I learned to sit in your discomfort and those feelings, feel them, and then do away with them. Okay, I'm over it. I'm giving myself this much time and then I'm going to be over it and I'm going to move on to something else, because life is so short that like this can't be my whole life, and it's not my whole life. And there's so much more to to me than just this. And when I've done my job good, when I feel satisfied with it and I know I've done well, I can close that door when I get home and just let it be. And I know it's hard. Sometimes you can't help but let it bleed into your life. But I think for me personally, I started therapy, eye-opening. I know not everyone can do it, but it is very helpful for me personally. And I know it's kind of taboo, especially in the Asian community. I talked to my dad about it. What is that? Just like, what is that? I'm like, you talk to someone. He's like, I have no idea what you mean. Just like, I don't even know how to explain to him, even if I speak Chinese, I don't even know how to tell him what it is. And he just doesn't get it. And so, and it's comforting to know that my sister-in-law, she also goes to therapy. Her parents also don't know what therapy is. So we just like kind of commiserate together and talk about how there's this kind of generational gap. She's also a health professional, but she's she's not in veterinary medicine. So it's nice, like Michael said, to have friends outside of this field and outside of this career. It's nice to have hobbies outside, and it's nice to have goals outside too. And one of the things that actually, when people interviewed me for residencies, they asked, like, what is your 5-year goal from now? And I was like, well, in 5 years, I'm going to be a real estate mogul. And they're like, what? Because they expect you to say something about veterinary medicine. But I just explained my life philosophy is I do this because I love it, not because I have to. I have things outside of this job that are going to help support me so I can keep doing this no matter what. And I'm not tied to this financially. And that's always been kind of my thought process for a long time now. And I think I'm going off on a tangent. Michael doesn't want to hear about my real estate dreams and aspirations, but yeah, so that's kind of things that have helped me. And therapy, great, excellent place.
Okay, Candace, but really at some point I do want to hear about this real estate mogul thing. I'm very curious. So at some point I want to hear it.
There's a
Please.
whole plan.
I love it. No, can I hear it? I would like to hear it at some point, and maybe I could like steal it. That'd be great.
It involves LLCs. It involves a lot of moving parts.
Oh, brilliant.
Definitely link up after.
Oh, that's genius. That's genius. Awesome. Okay. Sorry. Okay. And the question was, what have I been doing since the pandemic, right, to take care of my mental health and well-being, correct? Okay, cool. I think through this, I think having experienced sort of being at this sort of like dead bottom and having experienced this while being married and having a daughter, I think what I realized was that I can't it was one of those situations where I said, I really can't crap out right now. I can't leave. I can't be in a situation where my wife has to take care of me and I leave her hanging with this 7-month-old child. And I think that was a visceral thing for me because I grew up with my mom had divorced when I was 2. And so until I was 8, it was her. And I think obviously I had, and fortunately, my mom's parents, my grandparents had sort of been part of that, like had taken, had actually helped sort of take care of me as well. And actually, because of that, Kimura is actually, when my wife and I got married, I took that opportunity to change my last name to Kimura for them. So I think that made me realize that was a spark to kind of make sure that I was doing things so that I can continue to be a team player and, make sure that I can be well to shoulder the responsibility. So, like it's my wife and me. So, and, we both have to take care of this living organism and human. So I think because of that, that really made me realize that I can't just, burn bright and then fizzle out and burn out. And so I think that it was fortunate that I was able to find a good therapist. And that took some time because I think the one that I was at, like that was sort of embedded in the vet school at Auburn, we did not jive. And I actually had to go to a friend, and because I was so frustrated and said, what am I doing wrong? Why this doesn't seem to be working? And at first he called me out on it. He's a psychologist, and he said, do you really want this to work? And at first the answer was no, because I was pretty skeptical about it. And so after some time, and like having him sort of walk me through it and realizing, yeah, this really isn't working, and finding somebody else that did. It took some time. So I want to make sure I share that, because I think for those that are, unsure how to get into therapy, being patient is really helpful. And it might take some time, and it takes conversations until you find that. And I think once I was able to find somebody to help me through this in Auburn, did not look, like it really helped. And then I think, I was able, and I think after that and finishing at Auburn and moving to here, one of the things that then I prioritized was that I needed to actually continue treatment. And I think being an internist kind of helps me to understand why continuity of care is important. As a kind of aside, like whenever I do go to the doctor nowadays, like when they tell me what's going on, what they need to know, and I give them my history, they're like, oh my gosh, that's the best history that, like nobody ever gives me a good history like that. I'm like, yeah, well, this is what you get when you've got an internist. So, so I think that was important. And I think knowing that, I think that having the priority that I have to be present in a way that I didn't necessarily have growing up, was sort of a really big motivator to take care. And I think to make sure that I'm not just pushing on the accelerator of my life, but making sure that it's either cruise control or, like following the speed limit, or maybe 5 miles under where it's safe in the busy streets of America kind of deal. I think I've finally let myself be willing to, I don't know, like, I think find ways to sort of detach as well. So, forcing myself not to worry about cases, because I do obsess about them a lot. And I don't know if that's an internal medicine thing or if that's just, just us in this profession kind of thing, but I have a really hard time not thinking, okay, good. Okay, cool. Nice to know. And I think also finding a hobby. So the hobby that I found during the pandemic was watching StarCraft 2 professionally. And I think what I realized from it was that the commentators that I was listening to, the way they were talking really sounded like evidence-based medicine, except for StarCraft. And I think that was really entertaining. So it was kind of nice. I'm really glad I feel very supported right now. Thank you all so much. So yeah, I think the short and skinny of it, in conclusion, is I think realizing that I can't, I have to, there are other people that are depending on me. And I think that really saved me a lot, to sort of make sure that I'm not just going full at one thing and finding times to rest, because oh geez, I can't find anything else aside from this corny thing about life as a marathon, right? It's not a race, it's a long distance thing. So there you go. I think I'm done with that.
It's so true. Actually, I have a funny story to tell about internists, like obsessing about things. Michael knows the story very well. So I actually broke my foot kickball last year when I was an intern. I was on this little scooter. I actually just had surgery to fix that issue. I'm back on the scooter, but when I was first on the scooter, I didn't really know how to use it well. And I was going from the scooter to my computer chair. And I'm just like pushing on the computer chair, trying to get in. It's like awkward. I'm non-weight bearing on this leg. And the computer chair flips over, and it flips. Then I flip with the chair. And then the chair, because the way it flips, the legs of it, as it's flipping over, pulls the table that it's under over. And then there's a computer on the table. And then the table comes with the chair. And then the monitor starts wobbling. And at this point, I'm already on the ground and I'm screaming. I'm like, oh my gosh. Michael is 5 feet away from me, watching all of this happen, just like this. But he's thinking about his case. So he doesn't come help me. And I'm on the ground watching this computer, like the table and computer starting to lurch forward and almost hit me and fall on me. And then our techs and our other residents in the treatment area come running in and like stop everything, help me up. It's fine. Michael, after everyone comes in and helps me, is like, oh my God, are you Are you okay? Classic internist, always in a different headspace.
I wanted you to fall, Candace.
I know you
It was
did.
actually intentional.
I know.
What a story. Oh my goodness.
Yeah, not necessary, but I just call it.
Thank you for sharing that.
Yeah, thank you for sharing that, Candace.
Okay, it's gonna be a little hard to follow that up, but so kind of our next question here is what advice do you have for the next generation of veterinary professionals?
I can, oh, do you want to go first, June? You definitely can. Oh, I guess my advice is kind of what I touched on earlier. I think there's a perfectionist in all of us. It's running rampant in our profession. And the reality is no one's perfect. And when you put this expectation of being perfect on yourself, you're really just putting yourself in a box and essentially in a jail. And the longer you let yourself sit in there, the tighter and tighter and tighter it gets until you explode one day. That's how I view it, at least. And that's my personal experience with that. And so I think like coming into this profession, for any students out there that are listening, or like new grads or anything, I think it's important to realize like you're not perfect and that's okay. And, you know, another thing I think is really big is like not judging others. And I know it's so hard. Like I think I was just talking to my other classmates the other day. At Western, we're a very non-traditional school. We don't have a teaching hospital. It's a very different structure than the typical veterinary academic world. And then I was thrown into this academic world at Texas A&M, totally different environment. And I'm like, wait, why is everyone mad at the intern? What did we do wrong? And I didn't realize there's this like, you know, totem pole kind of. And I think throughout the years, I've become a little judgmental of other people. But what I've noticed is that when you hold judgment for others, you're actually just judging yourself. And the harder you judge other people when they mess up, when you mess up, the harder you judge yourself and the harsher you are to yourself. So like one thing I tell my fourth year students is don't be judgmental. If someone does something wrong, just tell them. You don't have to whisper about it or like talk about it. You just go tell them, hey, you put a chest tube in the abdomen. That's in the wrong place, period, done, over. It happens, stuff happens. 2, don't let clients bully you. I know it's hard because as this profession grows, we kind of become almost like a concierge service and it's hard. We want to make them happy. We want to get those 5-star reviews. But at the end of the day, like I said, if you're practicing good medicine, you're doing what's right for your patient and you're kind to your client, that's all that matters. You don't need to suck up to them. You don't need to go above and beyond to them. You just have to be a good human being and they have to be a good human being to you in return. And so if people are bullying you, people are like not treating you right, fire them. Just do it. Like, I don't know how many times as an intern I got talked to, if you can't do those things, you can't tell a client they can't come back. I'm like, you haven't fired me yet for doing that. And this client made racist comments to my student. I have every right to fire them. And so I know it's controversial because I don't want to get anyone fired from their job, but I think if you have the position to stand up for yourself and for your staff, do it. It doesn't matter. Just do it. And yeah, and like the perfection thing, like no one's perfect. You're not perfect. Everyone's going to make mistakes. When you make mistakes, have grace for yourself and sit in those feelings of feeling whatever you want to feel. But remember, tomorrow's a new day. You have more patience. You have stuff outside of this that you can turn to. And when things get dark, just remember there's always people, even when you feel alone, there's always someone who you can turn to. Sometimes it might not feel that way, but there is someone. And just if you ever get in a dark place or feel lonely, just reach out. And that's my biggest advice for new grads or people that are younger in the profession.
For myself, I think what I'm actually reminding a lot of fourth year students is, I mean, give your all when you're on, but kind of as Candace said, you don't have to feel obligated to go more than what you have. I remember when I was graduating, a young veterinarian told our class, you know, if you just go a little above and beyond, your clients will really appreciate it. I think, yes, that is probably true, but there is a cost to that. And in fourth year medicine, and as you're young vets, I think there is always this pressure to do more. And I don't necessarily mean like to not do your best, but it's in the sense when a client asks like, oh, can I visit after hours? Or, why can't you call me at this time? Why can't it be done this way? And so I just encourage fourth year students to remember that they are more. And I feel like I've said that multiple times, but they shouldn't feel obligated that when a client asks like, oh, can you facilitate this visit, that the answer is yes. That they really take time for themselves, because it is a marathon that we run for the rest of our lives. And I think healthy practices start early, in establishing what you would like to do and how far you would like to go. And I think now, I still consider myself a young veterinarian. I've only been practicing for now going on 4 years now, but I do think that you'll realize when something is unsustainable, and everyone will get to a point, and it's not bad if you get to that point. But I think it's important to recognize that that is unsustainable. I should try and change that and ask for help. Because like Candace said, there will be people that will help you. There are people that you can turn to. And wherever you are, in whatever stage of life, someone will make sure to be there for you. I think I've learned that. I think I've been on the receiving end, the giving end. I think it's important, as Candace said, that you're not alone. And what has been really helpful for me is, being able to share a meal with someone. I think that is something that I really enjoy a lot, something that I'm able to take time on my schedule for. And I would encourage people to schedule things that they care about, because I saw this, I actually saw this on Facebook, so it's not, I didn't get this myself, but they're just saying like a good way to say, instead of I don't have time for, is I don't prioritize. And if you say things in that way, like instead of saying, oh, I don't have time for this, but you say, I don't prioritize this, that puts it in a different light. And reflecting what is actually true, because if you prioritized it, you would make time for it. And if you find yourself saying things, I don't prioritize sleeping, I don't prioritize, being able to hang out with people, over time, that is a different reflection than maybe a reflection of yourself that maybe you didn't want. And if it is something that you want, great. But for me, that helped me give a different lens through which to view how to take care of myself.
I guess so. I was thinking about sort of how to phrase these two things. So my advice would be, one, I think that I feel like there's a lot of things that we've talked about here where it feels like it's hostile, or it's not easy to, especially when we're the minority, to kind of go out to some of these other professions where there's even more of a, where you become more of a minority. But I do want to encourage the new generation of veterinary professionals to continue to have that spirit of adventure, and to be willing to go to try something if they're interested in it, even if they don't have the experience for it or the background. And I say that because even though I am now an equine internist, which feels really weird to say, having done all the things and having recently gotten those letters. But I went into vet school thinking, and a lot of people pegging me to be go into small animal, and I think my classmates found out that I wanted to do large animal internal medicine during white coat in 3rd year. So they had pegged me to be a small animal internist for 3 years before they discovered, and I had this major reveal. And it's something that I developed while in vet school, actually. So I didn't know this, and I went for it. And I think that one of the things that I'm really glad that I did is that because I don't have that pedigree, if you will. One of my favorite things to do is when I was, on clinics, is to help the small animal people that aren't comfortable with horses to get familiar and to love what, and to show them why I love it so much, because I got to develop that and I get to see a glimpse of that. And I think that because I don't come from this, I appreciate that it's a different language, and I appreciate it in a different way to help others understand a little bit better or a little bit differently. And something where I think when everybody sort of takes for granted, oh, this lingo and that lingo, right? And I think that the more that people have that courage to try it, and hopefully then more and more mentors can help them through it, and it becomes more heterogeneous and more diverse, it makes the profession better. But I think that it takes courage, and I think that that one of the things that really helped me with it was because I grew up in so many different cultures. I lived in Singapore and the UK and New Orleans and Zambia before coming to the States again. It made me realize that different people and different cultures and different perspectives, and I think all of those things really attracted me to try something different. And so I really sincerely hope that if don't peg yourself just because somebody has put this thing on you. If you want to try something, if you want to explore something, go for it. And just and I hope that you can find the right mentors to guide you. I think that's really important. The second one sort of, I think, moves on from that idea, and I share in this way, is that one of the two things that I hate people hearing while I was in vet school and beyond is like getting told by my upperclassmen, oh, just wait till you're in, the class above that you're about to go into, right? Like you don't even know, you don't even know yet what you're about to deal with. And I think likewise, I think some of the things that you hear from, from the people that have been in this for a while is, well, why, I had to experience that in vet school, or I had to experience that during my internship, or I had to experience this during my residency, so they should too. And I think those are like very toxic things. And I'm going to ask you to to do what you can to avoid saying those things. And in that regard, I hope that you consider, always taking care of the people behind you, and shaping it so that you leave that particular spot that you're in a better place. I think trying to make things better. And I think that that was something that I felt very strongly about, clearly. But I think that was something that when I was, doing clinics and rounds, I realized that a lot of what I was teaching came from things that I didn't feel like I got taught well, and I had to force myself. And I wanted to make it so that the students that were in that senior year leaving were more prepared than I was. I didn't want them to suffer in the same way that I did. And so I think that really gave me motivation. And so I hope that you'll sort of take your time to think about, what are you experiencing? Why does it suck? How can you make it suck less for the people that are coming after you? So that would be, I guess, my two pieces of advice for the next generation.
Thank you for all those very thoughtful answers, and seeing some different comments in there saying how people are agreeing with your advice. So yeah, we've just got a couple minutes left. I wanted to ask if anybody in the audience had any final questions or anything, or if any of our panelists had any final thoughts before we kind of close out.
sorry, I had one more thing that I just realized was as future veterinary professional, next generation, take care of the veterinary support staff. Love them, appreciate them, teach and learn from them. They were the teachers that helped me get through to where I am too. They will go miles for you. They are your people. And I just realized that that was, I think I don't know, sorry, it just kind of occurred. So sorry to interrupt, Marie.
That's okay. I think that was good information to add in, and I heartily agree that yeah, I wouldn't be where I am without the help of my technicians and other support staff either. So yeah, any other last questions, last thoughts from anybody? I don't see anything popping up in the chat yet. Yeah, I mean, if that's kind of, I think we just got a couple minutes left, so I wanted to take a moment here and just want to take a second here to thank our MCVMA sponsors for helping us, do all of this work, including these types of panels and all the other work for MCVMA. And then I know Yui wanted to make sure to give a shout out to the AAVMP sponsors as well.
Yeah, special shout out to our diamond sponsor, Banfield, and then our 2 platinum sponsors, BCA and the Veterinary Emergency Group. All 3 of them are also in this MCVA sponsor page, so works out perfectly.
Yeah. So I wanted also just to thank our 3 panelists for joining us tonight and being very open, honest, and vulnerable about everything that you've experienced in veterinary medicine, particularly in the last couple of years. I know that MCVMA and AAVMP, we really appreciate all of you coming and spending the evening with us, or late afternoon, depending on what coast you're on. And I wanted to thank all of the participants as well for coming. So I think that's it for the evening. Any final thoughts, Yui?
No, I'm just I'm so grateful for our 3 panelists that came to this, and I know for a lot of you guys this was a little last minute, but just truly appreciate everything you guys have shared, just for being vulnerable in this space and sharing your experience, being really open and honest about the mental health aspect and promoting therapy, which I've definitely benefited from as well, and talking about what we can do for future generations. And yeah, just thank you so much.
Great.
Thank you for having us.
Great. Thank you, everybody, and enjoy your evening.
Bye.
Enjoy your evening. Good night.